Welcome back to the Transplant Helper, where we attempt to provide valuable insights and information for organ transplant recipients. Today we're going to be diving into a treatment you may have heard of, plasmapheresis. Whether you've recently had a transplant or maybe you're preparing for one, understanding the role of plasmapheresis could be the key to your journey. Let's start by defining what plasmapheresis is. Plasmapheresis is a medical procedure that filters or removes harmful components from the blood, particularly antibodies. It works by separating plasma, that is the liquid part of your blood, from the blood cells themselves. Once the plasma is removed, it can either be replaced with a plasma substitute or it can be filtered and put back into the body. For transplant recipients, this process may be crucial, particularly if your body's immune system is producing antibodies that may be trying to attack your newly transplanted organ. This particular process is known as antibody-mediated rejection. Plasmapheresis helps to reduce levels of those harmful antibodies, giving your transplanted organ a better chance to function properly. So exactly how does plasmapheresis work? During plasmapheresis, the blood is drawn from your body and passed through a machine that separates the plasma from your red and white blood cells. The filtered blood cells are then mixed with a replacement fluid, either being a donor plasma or a plasma substitute, and then returned to the body. The entire process takes just a few hours, depending on the amount of plasma you may need. It could be longer or shorter. However, it is a non-surgical procedure, but it does require either being in clinic or maybe in a hospital while it's being done just because of the risk. Now let's talk about the benefits of plasmapheresis for organ transplant recipients. One of the main reasons for this procedure is it is being used to prevent organ rejection. After your organ transplant, your body and your immune system may recognize that new organ as a foreign object and try to reject it. This is where plasmapheresis comes into play, and it can accomplish several things. Number one, it can reduce harmful antibodies. Plasmapheresis can reduce the levels of anti-donor antibodies, that's kind of hard to say, which are one of the main causes of transplant rejection. By removing these antibodies, the risk of rejection decreases significantly. Number two, the prevention of acute rejection. For patients that are high risk for rejection, plasmapheresis may be used as kind of a preventatory means in helping to lower the body's immune response before the signs of rejection even appear. Number three, the treatment of antibody-mediated rejection. If rejection is already occurring in the moment, plasmapheresis can help to reverse that process by removing those damaging antibodies that are attacking your transplanted organ. What about risk and side effects? Of course, with any medical procedure, there are some risk and side effects to be aware of. While plasmapheresis is generally considered to be safe, there are a few things to keep in mind. Number one, the risk of infection. The procedure involves inserting a catheter needle into your vein, and there is always a very small risk of infection at the access site. Proper hygiene or proper medical protocols can help to minimize that risk. Number two, allergic reactions. In some cases, patients may have an allergic reaction to the replacement plasma itself or other substances used in the procedure. Symptoms may include itching, swelling, shortness of breath, and such as that, but these reactions are generally mild and very manageable. Number three, bleeding or clotting issues. Since plasmapheresis does alter the blood components themselves, there is a slight risk of developing bleeding or clotting. Medications or special monitoring may be required to help to manage this. Number four, low blood pressure. During plasmapheresis, the blood volume will decrease temporarily, which can sometimes cause lower blood pressures that might lead to dizziness, fainting, or lightheadedness. But keep in mind, your medical team will be there with you to monitor closely your vitals and to keep this under control. Number five, calcium imbalance. Plasmapheresis can cause an imbalance in your calcium levels, leading oftentimes to numbness or tingling, particularly in the lips or fingers. This is usually temporary, however, and will be addressed very quickly with calcium supplements. Number six, fatigue. Because this procedure does take a few hours and does temporarily at least alter your blood's composition, you may feel tired afterward. Rest is definitely recommended both before and after, and the side effect generally will fade within a day or so. So who might benefit most from plasmapheresis? The procedure is often recommended for patients with antibody-mediated rejection after organ transplant. Those with a high level of pre-existing HLA antibodies, which can make it harder to match a donor and increase the risk of rejection. Also, patients who are undergoing desensitization protocols to make their immune system come down to be more tolerant of an organ that will be transplanted sometime in the future. For these individuals, plasmapheresis can be an essential part of maintaining health and longevity of their transplanted organ. Plasmapheresis is a valuable tool in the arsenal of treatments that are available to organ transplant recipients. Helping to reduce the risk of rejection and or managing antibody levels can be extremely important to those who are at risk, especially for organ rejection. Although there are risks, the benefits often outweigh the downsides. So if you're facing rejection or at least have the potential for such a little higher than normal, this is probably a good treatment for you to look into. But be sure, if you're facing this treatment, talk with your healthcare provider, your entire team, to learn more about how it could help you in specific situations. Thank you for watching the Transplant Helper again today. If you found this video helpful, don't forget to like, subscribe, and then hit the notification bell so that you can get more tips and information for navigating your life after transplant. Until next time, as always, stay stronger, my friends.